Hello everyone. I am going to go over the syllabus for NRSE 3020, Pharmacology for the Transitioning LPN, or Licensed Practical Nurse. So as you can see, my contact information is provided. You can reach me at my office phone, or really the best way to reach me would be my email. My office number is 2225, second floor of Nix Hall, room 225. You can read about the instructor availability, online course information. Important things you need to know about the course. This is a 2-credit-hour course. Again, we are not going to be covering all of the pharmacology like we would with traditional students. You have experienced some of the pharmacology content in your LPN program, so we don't want to go through all of that again, but we do want to emphasize some of the pieces that you may not have received in your program. So this is a 2-credit-hour course, 30 clock hours. And really, we just wanted, again, to provide information for you on content that you have not been exposed to. So the course goals, of course, we're going to present the concepts necessary to safely maintain infusion therapy and to administer all IV medications, nutrition, and blood products. We are going to look at the anatomy and physiology that are involved with the administration of IV therapy, differentiate between the types of IV fluids, different infusion delivery methods, look at the pharmacological concepts and administration techniques, deliver concepts related to preventing and monitoring for complications specific to infusion therapy. Also, we're going to look at legal and ethical issues with infusion therapy, especially in relation to infusion certified nurses. We're going to explore the documentation required for the administration of infusion therapy. Much of that is similar to just regular medication administration, but there may be some differences. And of course, we're going to look at the role of the RN in administration and delegation of infusion therapy. Again, this is components of the course that you would not have been exposed to in your LPN curriculum. And then we'll talk about any other topics that may need to be discussed in the program. So our course objectives, our student learning objectives, describe the role of the RN in delivery of infusion therapy, relate the concepts of anatomy and physiology critical to safe IV therapy, legal, ethical, and professional issues in infusion therapy, explain potential complications of infusion therapy, relate appropriate nursing intervention for preventing and monitoring for those complications, calculating dosages of medications and flow rates for IV medications, explain specific nursing implications related to administering IV meds, and then demonstrate appropriate administration techniques for selected IV medications. Major topics, you can read those for yourself, as well as the curriculum threads. Textbooks that you'll need, Buchholz and Hink's MedMath Dosage Calculation Preparation Administration, Phillips and Gorski's Manual of IV Therapeutics, and then Weinstein and Hagel's Plumer's Principles and Practice of Infusion Therapy. And make sure you get the correct editions on those. We will be using the newest editions available. Again, email is the best way to contact me. I do try to answer emails as rapidly as I can. However, we do kind of allow 48 hours for us to get back to you. Typically, like I said, it doesn't take me that long, but I do, ask that you provide me or allow me at least 48 hours to get back with you. Of course, if you text me on or email me on the weekend, it'll probably be Monday before you hear back, so allow a couple extra days for that. Of course, this is an online course, so there's really not a way for me to monitor attendance. However, I will be going in and checking D2L to see how many times each student has logged on, how much time they have spent within the course content in D2L, and this really just helps me keep track of exactly how much time and effort our students are putting into it, because it is an online course. So we do expect you to be in the D2L site and really paying attention to how much time you spend looking over the content that we provide to you. Attendance and participation are judged by the student's completion of course assignments. Initial discussion board posts, and you will have discussion boards in this course, are due by day 3 of the module at 11:59 p.m., and that is Eastern Standard Time. Then your discussion board response to a classmate, which you are required to do each week, is due by day 7 of the module, and that is also by 11:59 p.m. Eastern Standard Time. We do ask that you check your online course at least daily, and just to make sure that we haven't posted any class information or updates or anything like that. Assignments and submission guidelines. So each week you're going to be responsible for chapter review questions. That's going to be your assignment for each week. This not only will help to enforce the content or reinforce the content, but it also helps me to make sure that you're in the content actively, reading, looking, studying. Those study questions that you will have or be assigned are in Plumer's Principles of Practice of Infusion Therapy. Those are intended, again, to help solidify the content and really to encourage critical thinking. There are 19 chapters. Each have 10 review questions. Each set of review questions are worth 5 points each. And there's only 10 questions. So that's 2 points or half a point per question. So it's not a whole lot of work, but I do expect you to put in the effort to do them. So when you submit your questions, what I would like for you to do is to actually type out the question text, the full question, and then in the answer, I want you to put it in parentheses. I want you to put the answer. So if the answer is A, you'll put an A in parentheses, B, a B in parentheses. This is part of the grading rubric. I expect that this will be completed this way in every question set. So you're going to type out the full question text, and then in parentheses you'll put your answer. These should be submitted to the appropriate Dropbox, which you will see under the Dropbox tab under assessments. And then those need to be submitted by 11:59 on the last day of the module. Now, all the modules, the first day is a Monday, the 7th day is a Sunday. So these need to be completed by Sunday at 11:59 p.m. Eastern Standard Time. You'll also have 13 quizzes throughout the semester worth 10 points apiece. And of course, we're going to use NCLEX style questions, which you should be familiar with. You've already had your practice on the NCLEX PN questions in your LPN program. So there can be a variety of question formatting. You'll also have dosage and calculation from Hinkey's Med Math. You'll be tested on the contents of chapters 5, 6, and 7. And the 3 dosage and calculation exams will be worth 25 points apiece. And I'll let you look at the grading scale or the grading policy yourself. Anything below a 75, of course, is failing, according to College of Nursing policy. So that's the syllabus. And you can email me with any questions.